Here are 50 MCQs on the renal system, structured nursing implications, each with answer one-sentence explanation. The renal system, 50 MQ. 1. Which structure is the functional unit of the kidney? A. Collecting duct. B. Nephron. C. Renal pelvis. D. Glomerulus. Answer B. The nephron performs filtration, reabsorption, and secretion. 2. Blood enters the glomerulus through the A. Efferent arteriole. B. Renal vein. C. Afferent arteriole. D. Arcuate artery. Answer C. The afferent arteriole brings blood into the glomerular capillaries. Starter 3. Which part of the nephron is primarily responsible for filtration? A. Loop of Henle. B. Proximal tubule. C. Glomerulus. D. Collecting duct. Answer C. Filtration occurs across the glomerular membrane. For the renal cortex contains A. Loop of Henle. B. Collecting ducts. C. Glomeruli. D. Renal pyramids. Glomeruli are located in the cortex. 5. The renal medulla is arranged in structures called A. Nephrons. B. Renal pyramids. C. Renal columns. D. Pelvis. Answer. The medulla contains triangular renal pyramids. The loop of Henle's main function is A. Filtration. B. Water and electrolyte balance. C. Acid-base balance. D. Hormone secretion. Answer B. The loop creates concentration gradients that regulate water and sodium reabsorption. 7. Urine drains from the renal pelvis into the A. Bladder. B. Urethra. C. Ureter. D. Collecting duct. Answer C. The ureters transport urine from kidneys to bladder. 8. The bladder muscle responsible for contraction is the A. Sphincter urethra. B. Detrusor muscle. C. Iliopsoas. D. Levator ani. Answer B. The detrusor muscle expels urine during micturition. The longest part of the male urethra is the A. Membranous. B. Penile. Spun prostatic. D. Internal sphincter. Answer B. The spongy urethra spans the length of the penis. 10. Which hormone increases water reabsorption in the collecting duct? A. Aldosterone. B. PTH. C. ADH. Renin. C. ADH makes collecting ducts more permeable to water. Level M. Aldosterone acts on which structure? A. Glomerulus. B. Proximal tubule. C. Distal tubule. D. Renal pelvis. Answer C. Aldosterone increases NHI reabsorption in the distal tubule. 12. Which structure stores urine? A. Urethra. B. Bladder. C. Ureter. Kidney. Answer B. The bladder temporarily stores urine. 13. Normal urine output per hour should be at least A. 5 milliliters per hour. B. 10 milliliters per hour. C. 30 milliliters per hour. D. 100 milliliters per hour. Answer C. 30 ml may indicate renal hypoperfusion. 14. The ureters enter the bladder at the A. Trigone. B. Apex. C. Dome. Neck. Answer A. The ureters and urethra form a triangular trigone area. Now to 15. Which condition is indicated by protein in the urine? A. Cystitis. B. Glomerular damage. C. Dehydration. D. Diabetes insipidus. Answer B. Proteinuria signifies compromised glomerular filtration membrane. 16. Most water reabsorption occurs in the A. Collecting duct. B. Distal tubule. C. Loop of Henle. D. Proximal tubule. Answer D. The proximal tubule reabsorbs 65% of filtered water. 17. Erythropoietin is produced by A. Bladder. B. Ureter. C. Kidney. D. Urethra. Answer C. Kidneys produce EPO to stimulate RBC formation. 18. A nurse monitors potassium closely in renal failure because A. Kidneys excrete potassium. B. It increases urine output. C. It causes dehydration. D. It increases calcium absorption. Answer A. Impaired teen. 19. The renal artery branches directly from the A. Aorta. B. Iliac artery. C. Femoral artery. D. Pulmonary artery. Answer A. Renal arteries arise from the abdominal aorta. 20. Foley catheter insertion requires which technique? A. Clean technique. B. Sterile technique. C. Surgical asepsis only. D. No special technique. Answer B. Urinary catheters must be inserted using sterile technique. Number 21. Which finding suggests a UTI? A. Hemoglobinuria. B. Leukocytes in urine. C. Ketones in urine. D. Low specific gravity. Answer. Pyuria is a hallmark of infection. 22. A GFR 60 for 3 months indicates A. Acute kidney injury. B. Chronic kidney disease. C. Urinary obstruction. D. Renal stone. B. A sustained low GFR defines chronic kidney disease. Now 23. The urethra's internal sphincter is A. Voluntary. B. Involuntary. C. Absent in males. D. Located in the cortex. Answer B. The internal sphincter is smooth muscle. 24. The renal pelvis is located in the A. Medulla. B. Cortex. C. Hilum. D. Capsule. Answer C. The hilum houses the renal pelvis and vessels. Renin release is triggered by A. High blood pressure. B. Low renal perfusion. C. Excess potassium. D. High urine output. Answer, renin increases blood pressure in low perfusion states. Number 26, which test best evaluates kidney filtration? A, BUN, B, serum creatinine, C, urine-specific gravity, D, hemoglobin. Being creatinine is the most specific indicator of GFR. 27, the macula densa senses, A, oxygen level, B, sodium concentration, C, RBC count, D, magnesium. Answer B, macula densa monitors NA-FMI to regulate GFR. 28, the ureters move urine via A, gravity, B, filtration, C, peristalsis, D, osmosis. Answer C, smooth muscle contractions propel urine. Number 29, hematuria most commonly indicates A, liver disease, B, respiratory issues, C, urinary tract irritation, D, hyperglycemia. Answer C, blood in urine suggests irritation or trauma. 30, creatinine is produced by the A, liver, B, muscles, C, pancreas, D, intestines. Creatinine is a muscle metabolism byproduct. 31, which structure concentrates urine? A, Bowman's capsule, B, loop of Henle, C, renal vein, D, bladder. Answer B. The loop generates hyperosmotic medullary fluid. 32, cloudy urine typically suggests A, renal failure, B, infection, C, hyperkalemia, D, diabetes insipidus. Answer B. Turbidity often indicates pus or bacteria. 33, a nurse should encourage fluids for which condition? A, heart failure, kidney stones, C, pulmonary edema, D, hyponatremia. Answer B, fluids help flush and prevent stones. 34, normal urine pH is A, 1 to 2, B, 3 to 4, C, 4.5 to 8, D, 8 to 10. Answer C. Urine is slightly acidic to neutral. 35, the collecting duct empties urine into the pelvis, B, glauces, D, urethra. Answer C. Collecting ducts drain into minor calyces. 36, which medication is nephrotoxic? A, acetaminophen, B, ibuprofen, C, vitamin C, D, insulin. Answer B, NSAIDs reduce renal blood flow. Hash 37, specific gravity assesses A, glomerular health, B, urine concentration, C, blood pressure, D, sodium levels. Answer B. It measures kidneys' ability to concentrate urine. 38, a major nursing concern for a patient with a Foley catheter is A, hypothermia, B, infection risk, C, hypertension, D, increased appetite. Catheters increase UTI risk. 39, the kidney capsule is composed of A, muscle, B, cartilage, C, fibrous tissue, D, fat. Answer C, a fibrous capsule protects the kidney. Number 40, the renal vein drains into the A, aorta, B, inferior vena cava, C, pulmonary vein, D, portal vein. Answer B. Renal veins return blood to the IVC. 41, a nurse suspects urinary retention when A, urine is pale, B, bladder is distended, C, patient sweats, D, pulse is slow. Answer B. A full palpable bladder indicates retention. 42, best way to prevent UTI in females, A, wipe front to back, B, wear tight clothes, C, reduce fluid intake, D, increase sugar intake. Answer A, reduces bacterial movement toward urethra. Number 43, most common organism causing UTI, A, S. aureus, B, E. coli, C, salmonella, D, streptococcus. Answer B, E. coli accounts for most UTIs. 44, sodium reabsorption mainly occurs in the A, distal tubule, B, glomerulus, C, proximal tubule, D, collecting duct. Answer C. Most NFMI is reabsorbed early in the tubule. 45, the bladder's lining epithelium is A, simple squamous, B, transitional, C, cuboidal, D, ciliated columnar. Answer B. Transitional epithelium stretches with filling. Not 46, urine that smells sweet may indicate A, ketones, B, infection, C, proteinuria, D, hematuria. Ketones give urine a fruity odor. 47, renal calculi most commonly contain A, lead, B, calcium, C, copper, D, sulfur. Answer B. Calcium stones are most frequent. 48, a low GFR causes retention of A, glucose, B, potassium, C, lipids, D, albumin. Answer B, reduced filtration leads to hyperkalemia. 49, the most accurate way to assess fluid balance, A, vital signs, B, skin turgor, C, daily weights, D, lung sounds. Answer C, daily weights reflect fluid changes precisely. 50, cranberry juice may help prevent UTIs because it A, kills bacteria, B, alkalinizes urine, C, prevents bacterial adhesion, D, increases potassium. Cranberry inhibits bacteria binding to urinary tract walls. Thank you. Have a nice day.